Welcome to an important discussion about your body's intricate hormonal system. Today, we're focusing on ovulation, a fundamental process in reproductive health. Understanding this process is key to recognizing when things might not be working as they should. Ovulation is the release of a mature egg from an ovary. This event is a crucial part of the menstrual cycle, marking the window of fertility each month. For those hoping to conceive, successful and regular ovulation is absolutely essential. However, for many, ovulation doesn't occur regularly or sometimes not at all. This condition is known as anovulation. It's a common issue that can significantly impact a person's reproductive journey. The consequences of anovulation extend beyond just fertility challenges. Irregular or absent ovulation can also be a sign of underlying health concerns that need attention. These issues can affect overall well-being and long-term health. Therefore, understanding the complex hormonal interplay that governs ovulation is the first step. It empowers you to identify potential problems and seek appropriate support. We aim to demystify this process and provide clarity. The menstrual cycle is a marvel of biological coordination. It's a complex dance orchestrated by a delicate and precise balance of hormones. These hormones work in concert to prepare the body for a potential pregnancy each month. Several key glands are involved in this intricate hormonal production. These include the hypothalamus in the brain, the pituitary gland, also located in the brain, and the ovaries themselves. Each plays a distinct yet interconnected role. The hypothalamus initiates this cascade by releasing gonadotropin-releasing hormone, or GnRH. This hormone acts as a messenger, signaling to the pituitary gland that it's time to begin its work. It's the starting gun for the entire cycle. In response to GnRH, the pituitary gland releases two vital hormones. These are follicle-stimulating hormone, or FSH, and luteinizing hormone, known as LH. Both are critical for the development and release of an egg. FSH, as its name suggests, stimulates the growth of ovarian follicles. These tiny sacs within the ovaries each contain an immature egg. Typically, several follicles begin to develop each cycle, though usually only one matures fully. As a follicle matures, it begins to produce estrogen. This hormone is vital for preparing the body for a potential pregnancy. Estrogen levels steadily rise as the dominant follicle grows larger and more robust. Estrogen plays a crucial role in thickening the uterine lining. This prepares the uterus to receive and nourish a fertilized egg. A healthy, receptive uterine lining is essential for successful implantation. When estrogen reaches a certain threshold, it triggers a sharp increase in luteinizing hormone. This sudden surge of LH is the definitive signal for ovulation. It indicates that the egg is ready for release. The LH surge causes the mature follicle to rupture. This releases the egg into the fallopian tube, where it can be fertilized. This moment marks the peak of fertility within the menstrual cycle. After the egg is released, the remaining part of the ruptured follicle transforms into a structure called the corpus luteum. This temporary gland has a very important job in the second half of the cycle. The corpus luteum primarily produces progesterone. This hormone further prepares the uterine lining, making it even more receptive. Progesterone is crucial for maintaining a potential pregnancy in its early stages. If pregnancy does not occur, the corpus luteum eventually breaks down. This leads to a drop in progesterone levels, signaling the start of menstruation. The cycle then begins anew. Ovulating issues, or anovulation, fundamentally stem from a disruption in this delicate hormonal cascade. When any part of this complex system is out of balance, ovulation can become irregular or cease entirely. Identifying the specific disruption is key to effective management. Polycystic ovary syndrome, or POS, is one of the most common causes of anovulation. It's a complex endocrine disorder characterized by hormonal imbalances, irregular periods, and often, multiple small cysts on the ovaries. POS affects millions of women worldwide. In POS, there are often elevated levels of androgens, which are male hormones. These higher androgen levels can interfere with the normal development and release of an egg, leading to anovulation. Insulin resistance is also frequently associated with POS, further complicating hormonal balance. Beyond POS, several other specific conditions can lead to ovulating issues. Understanding these diverse causes is important for accurate diagnosis and tailored treatment. Each condition presents unique challenges to the reproductive system. Hypothalamic amenorrhea occurs when the hypothalamus doesn't release enough GnRH. This can halt the entire hormonal chain reaction necessary for ovulation. It's a form of anovulation often linked to lifestyle factors. This condition is frequently seen in individuals who engage in excessive exercise, experience extreme weight loss, or are under significant stress. These factors can signal to the body that it's not a safe or optimal time for reproduction, thus suppressing ovulation. Hyperprolactinemia is another cause, characterized by high levels of prolactin. Prolactin is the hormone primarily responsible for milk production. Elevated prolactin can interfere with the normal pulsatile release of GnRH, thereby disrupting ovulation. Thyroid disorders, both hyperthyroidism and hypothyroidism, can also significantly impact the menstrual cycle. The thyroid gland plays a crucial role in metabolism and hormone regulation. Imbalances can disrupt the delicate hormonal signals needed for ovulation. Premature ovarian insufficiency, or POI, is a condition where the ovaries stop functioning normally before the age of 40. This leads to a depletion of eggs and a decline in hormone production. POI can cause irregular periods or complete cessation of ovulation. Finally, certain medications can also interfere with ovulation. Examples include some antidepressants and antipsychotics, which can affect hormone levels, particularly prolactin. It's important to discuss all medications with your healthcare provider if you are experiencing ovulating issues. Diagnosing ovulating issues involves a comprehensive approach. Your healthcare provider will typically begin by taking a detailed medical history. This includes questions about your menstrual cycle, any symptoms you're experiencing, and your overall health. A physical examination will also be conducted. This helps to assess general health and identify any physical signs related to hormonal imbalances. It's an important step in gathering clues about the underlying cause. Blood tests are crucial for measuring hormone levels at different points in your cycle. These tests can assess levels of FSH, LH, estrogen, progesterone, prolactin, and thyroid hormones. They provide vital insights into your hormonal profile. Treatment options for ovulating issues vary significantly. The approach depends entirely on the underlying cause identified through diagnosis. There is no one-size-fits-all solution, making accurate diagnosis paramount. For some, lifestyle modifications can be incredibly effective. This might include adjusting exercise routines, achieving a healthy weight, or managing stress levels. These changes can often restore hormonal balance naturally. Medications to induce ovulation are a common treatment for many forms of anovulation. These medications work by stimulating the release of hormones that encourage follicle development and egg release. They are often used in fertility treatments. Other interventions may also be necessary depending on the specific diagnosis. This could involve managing underlying conditions like thyroid disorders or insulin resistance. A personalized treatment plan is always the goal. Understanding the hormonal complexities behind ovulation is truly the first and most empowering step. It allows you to recognize the signs of anovulation and seek the right support. Your body's signals are important, and learning to interpret them is invaluable. Our goal in sharing this information is to help you address any ovulating issues you may be experiencing. We want to support you in achieving your reproductive health goals, whatever they may be. Remember, you are not alone in this journey. Seeking professional medical advice is always recommended if you suspect you have ovulating issues. A healthcare provider can offer personalized guidance and a clear path forward. Taking charge of your health begins with knowledge and proactive steps.